My name is Martin Bell. I'm a board-certified plastic surgeon and have been in practice for 30 years. One of the most common cosmetic surgeries that we do is an eyelid plasty, technically known as a blepharoplasty. And the purpose of that operation is to remove excess skin from in and around the eyes, as well as to remove some bulging excess fat that comes up from behind the eye and bulges up to the front. Since the eyes are the central feature of the face and where other people look at us first, a beneficial change in the eyes is perhaps the most beneficial change in the whole face because it catches the attention of other people right away. And so a beneficial change in the appearance of the eyes, notwithstanding whether the patient needs a facelift or anything like that, just improving the appearance of the eyes alone can make a major change in the patient's facial appearance. Now, we're going to look at a diagram. And the first diagram shows the excess skin of the upper eyelid. And since it's different in different people, different in amount, different in shapes and locations, we carefully measure the skin excess. We mark it with an ink pen, and then we remove the excess skin of the upper lid. We also usually remove a little fat in the inner corner of the upper lid because many people have a bulge right there, so that's what this is supposed to show. And then we stitch up the incision following the crease of the upper lid so that the scar, when it heals, is barely, if noticeable at all. And the next diagram shows you where the incision ends up, which is in the crease of the upper lid. And depending on how much hanging skin there is, we may have to go out to the side. But upper eyelid incisions heal very well, and scars from blepharoplasty are very minimal if they can be detected at all. Now, on the lower eyelid, we have a combination of excess skin and bulging fat. We make an incision along the lower margin of the eyelashes. We turn the skin and the fat down. We find bulging fat under the skin in the inner, the middle, and the outer locations, and we trim that fat away. And then we pull the skin to the side to tighten it up. We remove the excess above the dotted line, and we stitch up like this. And once again, these scars are barely noticeable on the lower lid. It takes a few weeks. On the upper lid, it only takes a week or two. We take the stitches out in about 5 days. In some patients, instead of making this incision under the lash, if they don't have a lot of bulging excess skin in the lower lid, we can actually go through the back side of the lower lid, take out the fat that way, and not do anything to the skin. Either way, a beneficial change in the appearance of the eyes greatly improves the patient's appearance and removes the perceptions that the patient is tired or sad. And those are the kinds of things that patients tell us about when they come in and which we hope to relieve by the surgery.